Hello, everybody. Thanks for coming. Sorry about the delayed start there. Had to grab my water and Pepsi, make sure we got everything set up here. Becky, first in chat. Appreciate that. Awesome. Nuggets here, too. Crooked Orchid. How we all doing today? Happy Friday, man. We made it through another one. We got a wild topic today. I'm going to try and make it not boring, you know? Present my opinions without getting angry. Hopefully CB and Jelly can make it in here at some point because they are the chat experts on healthcare. I'm no expert. I remodel houses, you know. What do I know about anything? But I got opinions, and I'm gonna yell them. A lot of people are talking about healthcare this week and last week because of, you know, the recent passing of the former United Healthcare CEO Brian Thompson. Definitely a lot of hard opinions on both sides of the argument, and I figure we could talk about it in a non-political way and see if we can wade through this issue. But yeah, hope you guys had a great week. I definitely did. Be nice to have the weekend off, but I will be working tomorrow and Sunday. So. KO says, I can tell you a few opinions, thumbs down. Yes, I'm with you. I'm right there with you. It's hard to have a positive opinion about healthcare unless it's personally touched your life, you know? And certainly, I wouldn't disparage providers of healthcare, people who work in the healthcare industry on the front lines, doctors, nurses, the guy who cleans up the hospital. All of those people are super important. But KO says, working, I thought you were stopping for the holidays. I am stopping for the holidays, but I have to finish this project first. So once I finish that, then yeah, I'm going to take a few weeks off. That's going to be really nice. Should be done here in a few days. But yeah, so I thought we could talk about a few of these stories I found. The first thing that I kind of thought was like the biggest problem really is the prescription drug prices. And I feel like that's where a lot of people have their biggest complaints with the healthcare system. And if you look at our here they are. Okay, so if you look at how much we pay for prescriptions versus other countries, Nugget says the missus is stuck in Alabama right now, taking care of her biological mom. They won't cover a nursing facility and treatment at the same time. So they'll cover the nursing facility as long as she doesn't need treatment. And they'll cover the treatment as long as she doesn't need the nursing facility. So while you're getting treatment, they got to kick you out. That seems backwards. I'm sure it's not cheap either. And that's a lot. Definitely for your wife to have to take that time, and that's a tough thing, you know? You definitely, um, you definitely have that instinct to take care of your loved ones, but also, you know, we have these systems in place for a reason. And we pay a lot of money for them, and so it's really disappointing when they don't deliver on the one thing that you paid them for. Which let's leave it like Rover's condo. No, I wouldn't do that. I'm not gonna drag something on. Oh, Nugget says also the first time meeting in person. Wow. 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 Oh, okay. So it was her okay, that's why you specified biological mom. Okay. So this experience is her first time literally meeting her biological mother, and that experience is just her physically taking care of her because the system has let them both down. That's terrible. But I mean, it is a perfect illustration of what we're talking about and why we have a problem in this country with this stuff. Yeah, man, I'm sorry that you guys are going through that. I hope it goes well and the treatment is effective. Oh, they texted for years, but it's the first time seeing face to face. Okay, good. I got you. Well, I mean, you know, I guess it's good that they're meeting face to face, but it's a shame it's under those circumstances. But you know, we gotta take advantage of the time we have, you know. So that's good that they're finally at least seeing each other, and hopefully her mother makes a recovery. But yeah, I just like I guess my first point is just the cost of prescription drugs. Okay, this is scroll back up so you guys can see here. This is from the National Library of Medicine at the NIH, National Institute of Health, and they did a study comparing the cost of prescription drugs in our country to those of other developed nations. And we are paying considerably more than other countries are. And there's a lot of complicated reasons for that. And I am going to explain them terribly. But hopefully, yes, Chaos Elmo is needed for this topic. That's right. That's right, KO. Oh man. But yeah, there's several different reasons why the prices are so high here versus other countries. But there are some things we can get lower, you know, like they're talking about generic medications and how they are, you know, a cost savings and other discounts and blah blah blah. But really the biggest thing for a lot of people is just the price of the medicine, because if you don't have health insurance and you have to pay cash for a medicine, it's not just a couple dollars. You know, you're not buying Tylenol. You're buying some $400, $1,000 a month prescription that you may need to live, and you only have one place where you can get it from. And that place is the horrible United States healthcare system. KO says there's a migraine medicine that her man gets that's $100 a pill if insurance doesn't cover it. 10 pills is $1,000 Now, I am not saying that innovation is free or should be taken for granted, or that anyone who works in the drug industry shouldn't be paid a fair wage for their job. But Lord have mercy, $100 a pill is, I mean, street drugs don't cost that much money. That's insane. Absolutely insane. Nugget Man says, how do those free pharmacy discount apps work? Well, it's interesting you bring that up. The way they work, like GoodRx and I don't know. That's the only one that I know of offhand, but there are a few of those. And the way they work is by skipping over your insurance completely. Because if you try and use your insurance, you're going to pay the negotiated price that your insurance company has negotiated. But if you use something like GoodRx, they will throw away your insurance if the cash price can be had from a cheaper source. And you would think that everyone would want to do that. We all want our stuff to come from the cheaper source. I feel like that's a no-brainer. And people like Mark Cuban and his new company, I can't think the name of it right now, but it's similar to GoodRx in the way that the way Mark Cuban's company does it, I believe, is they do like bulk buys of these medications directly from the companies. I don't know. I should have looked that up, because Mark Cuban is actually trying to do some work to make those pharmacy discounts a little bit more ubiquitous. So in this paper from Johns Hopkins, Americans on average continue to spend much more for healthcare while getting less care than people in other developed countries. The paper found that the United States remains an outlier in terms of per capita healthcare spending. Per capita healthcare spending, that's each person. $9,892 was the per capita healthcare spending in 2016. That amount was about 25% higher than second place Switzerland's $7,919. So a good $2,000 higher per person than the next most expensive place, which is Switzerland, who has a fantastic healthcare system. It was also 108% higher than Canada's, which is 4,753, and Canada gives all of their citizens healthcare for free. Oh, Lord have mercy. It's so hard not to get mad about this stuff because it just makes no sense. It makes absolutely no sense. And that number from 2016 was more than double the amount we spent per capita in 2000. So, yeah. Definitely, we're definitely not going in the right direction as far as the costs. Now, one point that a lot of people will make is that the capitalist system is what drives innovation. And if you don't have that competition between drug manufacturers, insurance companies, insurers, hospitals, there'll be no innovation without the competition. And I used to kind of agree with that. To be honest, when Obamacare was first being discussed, I was initially against it because I looked at it like, I don't need the government to hand me anything. I don't want the government healthcare because I've been Oh, Tessa's in the chat. Hey, how you doing? Good to see you. I was not a fan of initially of the government healthcare because I thought, look at the BMV. You want the hospital to be run by the same people who run the BMV, you know? And looking back on it, it's kind of a disingenuous argument because the people who work in healthcare because they care. And nurses, doctors, it's a special breed of person. Not everyone can do that job because it's not just memorizing the stuff and knowing the knowledge. It's about caring about the patient's well-being and their outcome, and using your knowledge and expertise to exert a positive influence on other people. So I definitely think, they deserve all of the money that they get. That is not my point at all. We definitely shouldn't be taking money away from people. I feel like probably a lot of people in the healthcare system as a whole are underpaid, even though, we typically look at like doctors and nurses. It's a really successful profession and those people do well in society, and they should. But yeah, KO says, I just want to be insured. It's like car insurance. See, but it's not like car insurance, because in car insurance, you're kind of getting the same product from everybody. The amount of coverage and the nature of the coverage, they pretty much all have the same rules. They pretty much all have this, the prices are different based on where you live and risk factors and all of that. But I really think it's unfair to take those same metrics from the auto insurance industry and apply them to the healthcare insurance industry, because it's not the type of thing I feel like we should be pinching pennies on, and trying to extract shareholder value for, because it's kind of an innate right that everyone has or should have, the right to care and being healthy. And I think as a species, that's like number one on the list is like keep everybody alive, right? So so now I am in favor of the government paying for it, and maybe that will upset people, but this is the only way for things to really get better, is if we have a single payer system, like a lot of other countries do. Covered California kicks ass, says Nugget. People pay what they can afford for their health insurance. Okay, see, yeah, I've heard of those kind of income-based programs, and that's great. And I think that is also how the Affordable Care Act works. You pay based on your ability to pay. But now, while that is great on the low end, if your ability to pay, let's say, you're well off, that doesn't mean you should pay $1,500 a month for health insurance for one person. That's out of control. I mean, even if you're bringing in millions every year, that's a lot of money. So, KO says, if the government needs us to work to support it, then they should support. Exactly. Where are we going to be if everyone in our country is sick and dying from curable diseases because we just refuse to do anything about it and have this pull yourself up by your bootstraps attitude about everything? It's absolutely insane, man. It's insane. They don't pay taxes. They don't pay health insurance. Yeah, exactly. Exactly. Rich people don't pay anything. They don't pay for anything, and they have the most ability to pay, and they pay the least. Yeah. And Nugget says, then you have nice health insurance through your high-paying job. Exactly. Everyone who has a high-paying job, they have employer-sponsored healthcare, which is subsidized by the employer. It's much more affordable. And generally the plans are better quality. You're going to pay less out-of-pocket costs for doctor's visits and prescription drugs. I mean, just even our own government admits that that our system's not working, you know? Because we have these things here. I'll pull this up. We have these guys called the Pharmacy Benefit Manager. Okay, the PBM. That's right. Yeah, KO says hazardous. Yes, PBMs are very hazardous.
We're considered a hazardous building.
Hospitals are hazardous buildings for sure. But yeah, so PBMs. Pharmacy benefit managers, according to this article from the National Institute of Health, it came about almost by accident, because of where is that? So the PBMs were originally for people who had employer-sponsored health coverage, because that's what almost everyone had. In 1940, only 9% of Americans had health insurance, but by 2017, employer-based health insurance was the most common form of coverage, with about 167 million workers and dependents under 65 having employer-based health coverage. But I would say that number is probably lower now. I don't know, just spitballing. I don't know that to be the case, but the whole point of the PBM was to lower the price of prescription drugs by negotiating the drug prices down, basically. But PBMs are actually increasing the drug costs instead of decreasing them. Drug manufacturers actually raise their prices due to PBMs. As PBMs demand larger and larger rebates or discounts, manufacturers offset these reductions by raising the, quote, list price for the drug. PBMs encourage this practice because they receive larger financial rebates from more expensive drugs. So what that means is, because the PBMs need to make more and more money for their shareholders, they need to bring in more and more of these rebates. And in order to get those rebates, the drug companies just inflate the list price. Much like how on Black Friday, everyone was like going to buy their TV, and you don't realize that everything still costs exactly the same as it always did. They just raise the list price. So your $599 TV, they raised the list price to $799, and then they put it on sale for $599. Look, it's $200 off. Look at how much we saved you. And the reason that is such a huge problem is because that list price is what is paid by people who don't have health insurance. People who are paying cash for a drug are getting punished because these guys need to keep up the appearance that their job is important and also drive ever increasing revenue. Because that's the thing in this country is shareholders are the only thing that matter. And as long as your revenue goes up every year, year over year, it doesn't matter how you do it. But yes, so there's a huge conflict of interest here with the pharmacy benefit management market, because its very existence is what causes the prices of drugs to increase. And its whole idea for establishing it was to lower drug prices. So we really should just get rid of these guys. But yes, so they, the PBMs also own their own pharmacies, and so that's why it's a conflict of interest, and it chokes out, you know, small businesses that are trying to run a pharmacy. And so let's see here. What one of the questionable practices, according to this article, that PBMs engage in is called spread pricing, where PBMs pay a lower amount to the pharmacist than they report to the health plan sponsor. So, that's gotta be, it should be a crime, right? I mean, so you're telling me, if that's fine, I'm just gonna lie about the amount of money that I donated to charity in order to reduce my tax burden. That's fine, right? If they can do it, I can do it, right? So I don't understand. I don't understand how they continue to get away with this, other than the fact that all of the people who have the most money in our country are the ones who are in charge of this stuff. So they actually mentioned Mark Cuban and how he is taking on these prescription drug costs with his company is called Cost Plus Drug Company. They currently offer 350 generic drugs, and they have 1.5 million customers. Basically, so they're selling generics. That's how they get it cheap. In July 23, Cuban offered on his website a biosimilar version of the world's highest grossing drug, Humira, at a 90% discount, $569, instead of the current price of $6,922. And we're talking about Mark Cuban. You know, this guy's got more money than he knows what to do with, and he's using it to help us, which is just absolutely amazing. And I really wish that more wealthy people would take on an attitude like this versus just simply trying to extract as much money out of us as possible on these things. But let's see here. Here's a study from Harvard that found that 45,000 people a year die because they don't have health care. 45,000 people a year in one of the most developed nations in the world. They're dying because they just don't have insurance and they can't afford to save their own life. Absolutely insane. Absolutely insane. The study was conducted at Harvard Medical School and Cambridge Health Alliance. Found that uninsured working-age Americans have a 40% higher risk of death than their privately insured counterparts, up from a 25% excess death rate found in 1993. So if you don't have health insurance, 40% more likely to die just because you don't have health insurance. Who is the guy that jacked up the price of EpiPens or something, KO says. Oh, you're thinking of Martin Shkreli. Shkreli. He actually went to prison for that. And honestly, that's kind of an interesting topic because from what I remember about that, he was actually like the scapegoat. He was like a new CEO of this drug company, and they needed to raise the prices of their drug because they were losing money or something like that. And so he just basically was like, I'll look like a total jerk, no problem. And he did it, and he went to jail for that. Yeah, so we can talk about that in a future episode, maybe. The real story of Martin Shkreli. KO says, I'm sure they can still work. That's right. That's right. Don't let death stop you from showing up to your job, okay? You better still be there, even though your job doesn't pay you enough to have your own health care. You got to still be there. And if you get sick, actually, you'll be penalized for that. So the actual number from the CDC, the estimated lack of health insurance causes 44,789 excess deaths every year in our country, which is just... So it's heartbreaking because these are things, these people are passing away from curable ailments. That's right, a hazardous job. That's right. They went into a hazardous job, says KO.
We're considered a hazardous building.
And if you're working in a hazardous building, you better make sure you have health insurance, because if you don't, you're going to be on your own when you break your leg. Not at work, though. Thankfully, the workers' comp would cover you there. But most of the time when we get injured, it's not at work, unless you have one of those type of jobs that is dangerous. This paper here estimates the annual deaths caused by lack of health insurance to be closer to 40 to 80,000 per year. COVID deaths linked to uninsurance topped 300,000. 300,000 people died of COVID because they didn't have health insurance. That's insane. Insane. Annual deaths attributable to underinsurance are substantial but harder to estimate. Okay. About half of all adults skip or delay care. That's crazy. Absolutely crazy. But yeah, so they say here, we know this, yet we don't fix it. Why not? Opposition from corporations and the elected officials they support and lobby. That's right, because they have all of the money to lobby, so they get the laws passed that favor them. And all of these guys in Congress are invested in these companies, so obviously it's in their best interest to make sure that the shareholders are the ones who win and not the insured, you know? Not the people who are actually paying the revenue that comes into the company, but the people who own shares in the company. That's who's valued. And it's absolutely insane. The politicization, whatever, of this argument is just disgusting to me, because regardless of which side of the aisle you sit on, you deserve to live. And I mean that for everyone. That's what this country is about. And to say that because you don't have health insurance, well, forget it. We can't do anything about it. We actually can. We just choose not to. But the recent death of the United Healthcare CEO has definitely brought all of this to the forefront. I thought this was an interesting graphic from NCDS medical billing from their article, How to Manage Insurance Company Claim Denials and Insurance Eligibility Verification. Sounds like a great read. But here's the photo from the article. Most common reasons medical claims are denied. 48% prior authorization. 42% doctor not covered by plan. 42% billing code issues. You're telling me because of billing issues, people aren't getting their health insurance, and we can't do anything. There's no way to fix it. I wish Jelly was here because I believe she works in medical billing. KO says, health insurance, rip it up and forget about it. That's right. Forget about it. Rip it up. Keep paying for it, but yeah, you might as well forget about it because whatever you're paying for, they're not going to cover anything. 35% of claims are denied because the claim was not submitted before the deadline. There's a deadline? There shouldn't be deadlines. That's insane. That's absolutely insane. I apologize to if you're listening to this in headphones because I'm getting loud. 27% are denied because the plan changed what drugs were covered. 33% are denied because there's not enough staff to keep it up. This is... How can any sane person read this and be like, you know what? We have a great system in this country. This is fantastic. We're so lucky to live in America. Nugget Man says, didn't Nixon have something to do with the beginning of this health insurance BS? You know, maybe he did. I know that there was like some initiative after World War II to try and get more people to have health insurance because in 1940, only 9% of Americans had health insurance. But I don't remember who, I don't know. I'd have to look that up about Nixon. Let's see here. Oh, in October 1972, Nixon signed the Social Security Amendments of 1972, which extended Medicare to those under 65 who have been severely disabled for over 2 years or have end-stage renal disease, and gradually raising the Medicare Part A payroll tax. Oh yes, he did have a comprehensive health insurance plan. Here it is. From the Richard Nixon Foundation. Nixon said, without adequate health care, no one can make full use of his or her talents and opportunities. It is thus just as important that economic, racial, and social barriers not stand in the way of good health care as it is to eliminate those barriers to a good education and a good job. I mean, you know, I know he was a crook, or as KO says, he was not a crook. Becky is back. Welcome back, Becky. Thank you for being here. But yeah, I mean, I definitely agree with his statement there. KO says that number could have been 100 if the government took care of it. Yeah, exactly. Um, and that's certainly a concern, with single payer, and that's what a lot of people are worried about. Is, if I get this government health insurance, they're not going to cover anything, and I can understand why you would have a lack of trust in the government, but they really have the most power to influence this situation, because the companies who have all of the money in the world are the drug companies. Just like we talked about in the previous episode about prescription drug commercials, 67% of TV advertising is paid for by drug companies, okay? They are doing just fine on our backs, okay? They're all buying a Mercedes on the back of your medical expenses. But oh, sorry, I didn't click back over here. So this is a site trying to tell you how to get around insurance claim denials. KO says, honestly, Drew, it's also the doctors that are the issue too. Think of the top. Yeah, okay. So the doctors are expensive, but also KO says they get paid mad money. They do. But number one, without doctors, we're hosed. So they should get paid a lot of money. But another reason that they make a lot of money is because of the insurance costs for them. They have to pay something called malpractice insurance, which covers them if they do something that causes a negative outcome for one of their patients. And that increases the costs of them running their private practice. Hospitals also have to carry malpractice insurance, and that definitely drives up the cost. And another major contributor to doctors being expensive is that their education is expensive. They have $200,000 in student loans, and they have to pay it off somehow. And they just spent, however many years, 8 years in school to get where they're at. So, really, we want to encourage people to become doctors. And so I think that they should get paid fairly. And nurses too. Absolutely nurses. I feel like nurses, yes. KO says they don't pay all that money for schooling, but if it was government funded. Exactly. Imagine if we could fix the skyrocketing education costs, how much that would benefit these doctors and nurses now that they wouldn't have to pay so much money to get the degree that allows them to do the job that they want. KO says, sue the government. See where that goes. Yeah. Nowhere. But that's why I think the government is really our only chance at battling these healthcare companies because, I don't know. All of these guys, the politicians, are probably on the take from these health insurance companies, the lobbyists and all of that stuff. So I'm sure that relying on the government to help us out is kind of a pipe dream. But KO says nurses should get more money. The care they give is way more of the issue. Yeah, absolutely. And I think a lot of people would agree with that. Nurses are doing the heavy lifting in the healthcare industry, and they're the ones who are there face to face with the patient most of the time. So, they definitely should be getting paid a lot of money. My sister's a nurse, my mom's a nurse. I have so much respect for anyone who's in the medical profession, because Personally, I couldn't do it. I could not do it. Somebody came in with like a disfigured arm or something, I'd be like, gross, get out of here. Nah. Somebody's gushing blood, I'm gonna be puking on the floor. Like, you're gonna have to give me oxygen. You know what I mean? I'm not the guy. So whoever does want that as a job, I think we should do whatever we can to support them in that endeavor, because if nurses and doctors in that becomes a profession that's not desirable, we're gonna be in big trouble as a country if people don't want to be nurses anymore. Big trouble. Becky says only if they care about the people, not the one who is in for the paycheck. Yeah, and I'm sure there are those people out there that working in the healthcare industry is just a job for them, and it's the same thing as working at Costco. But I feel like the majority of people that are in that business are in that business because of the reward that they get from it, non-financial reward that they get from it. You know, it's a rewarding profession, I would imagine. And that definitely helps as far as getting people to want to do it. You got to make it desirable. But yeah, I mean, malpractice insurance is a huge problem. Education costs is a huge problem, but that's not the doctor's fault. So I don't blame them for that. And I think we should definitely be working on that too. But after this healthcare CEO, you know, was taken down by the alleged suspect, it got political really quick, and I don't think that it should. I don't like talking politics, and we're not going to talk politics on this channel ever. So if you don't like talking politics, you're in the right spot. But I can tell you, on both sides of the aisle, after Brian Thompson passed away, unfortunately, everyone started yelling across the aisle immediately. Like, that was their instinct. Now, I don't think anyone should... I don't think... let's see. KO says, I blame the government. It's Luigi, not Mario. That's right. This guy... That guy Luigi, he's a very polarizing person. Tessa says, thank goodness, I'm so over political chat. Me too. Me too. I don't want to hear either side of it, because all politicians are hypocrites on both sides. It doesn't matter which side you're on. And I know that for a fact, because if you ask the person on the other side, who are they going to yell at? They've designed this system to keep us fighting with each other about dumb things, so we don't realize the big things like this, about how they're screwing us, basically. Becky says, thanks for no political talk. You are welcome. I hate all parties equally. And I feel like everyone's being a little disingenuous here. You know, on the one side, you got people who are saying, this guy's a hero, you know? Folk hero. And then the other side, people are saying, how can they say he's a hero? He's a killer, you know? And I think that being a hero is an interesting thing because it all depends on who's watching. Like in that subway strangling case where an altercation happened on the subway and a guy there was a person causing problems who turned out to be an illegal migrant, and this guy saw that this person was hassling a bunch of people on the train, and he grabbed him around the neck, and he's holding on to him. And that guy eventually passed away because of that. And a lot of the people who were there on the subway called him a hero because they felt unsafe in that moment. And he saved them from this guy. So then you got the other side where that guy didn't need to end this person's life over this, you know? So being a hero is complicated. And I don't think Luigi was trying to be a hero. I mean, obviously, you know, his motives are still yet to come, and maybe we'll hear more from him. His manifesto's out or whatever. I don't know if you even call it a manifesto, I guess, but I just thought it was really disingenuous when everyone, you know, the people who look at that guy on the subway as a hero are saying, well, how can you say that this guy is a hero because he's killed someone? And they're right. Neither of those people should have died. This healthcare CEO didn't deserve that. But also, it has really ignited change in our country. And all of this hand-wringing, to me, makes no sense. Because now, while we'll say, yes, obviously, murder's bad. Don't kill people. I don't want anyone to get hurt. But to sit here and say that this guy killing the CEO, that's illegal. But what the CEO does for his job, that's fine. And what he does is he gets paid millions of dollars to withhold life-saving medical treatments from people who pay him to pay for their medical treatments. It's absolutely nuts. Sorry, I gotta turn my mic down a little bit. I'm peeking over here. So everyone's all upset when someone dies, and you should be. But we should also be asking questions, like why is no one upset when 26,000 people a year are dying because they don't have they got denied their medical coverage by their insurance company? The company that you pay every month for the sole purpose of, hey, if something happens to me health-wise, I want you guys to cover it. Here's my money. And the way they make money is not everyone is having catastrophic health issues all the time. KO says murder is bad. Okay, yeah, it definitely is. But I feel like if someone is dying from something and you have the power to stop that, to save their life, and you don't do it, how is that not killing them? That's not murder anymore? I'm serious. You're telling me that someone is bleeding to death in front of you. You could stop the blood, but you don't. Is that murder? I feel like it is. I feel like if you're standing there with a machine who can save someone's life, and that person has handed you money for their whole life every month in order for you to provide this one service just in case something should ever happen, and then it does, and then they're like, no, you know what? I'm gonna watch you die instead because the shareholders need to make their money. It's complicated. Now, obviously, the CEO himself is not making all of these individual decisions, but United Healthcare is one of the most ubiquitous deniers of claims than any other insurance company. Here we got a chart. Claim denial rates by insurance company. United Healthcare is right at the top at 32%. 32%. Almost 1/3 of the people who pay whatever, $500, $1,000, $1,500 a month to have coverage with a private health insurer, 1 out of 3 claims are denied. That's absolutely nuts. Medica is at 27%. Anthem, 23%. Aetna, 20%. CareSource, 20%. 20% is even crazy. You're telling me 1 out of 5 people, they just deny? They're like, no. You know, we have the ability to save you, but we're not going to because it's expensive. Here's another, these guys are also big players in the business. Molina Healthcare, 19% denials. Cigna, 18%. Blue Cross Blue Shield, 17%. That's crazy. I asked CB who she thought the best health insurer was. And she told me Blue Cross Blue Shield. And that may be true. But they're denying 17% of claims. And this is life-saving medical care, potentially. I mean, and so these people are forced to then pay out of pocket for these things, even though the whole purpose of paying all this money every month to the health insurance company is so you don't have to do that. It's just absolutely insane. And no other insurance works like that either. It's nuts. But I just, like, the auto insurance comparison, it to me isn't valid because human life is a precious, invaluable thing. And to say that that a person doesn't deserve care because they can't afford their health insurance, or they've got the wrong insurance company, or they went to the wrong doctor, that's insane. That's absolutely insane. It shouldn't be happening in our country, and we shouldn't stand for it. No one should. It blows my mind. But amidst all this hand-wringing and finger-pointing, and everyone saying, oh, well, healthcare is only expensive because of the political party that I'm not a part of. Well, now we've definitely flipped the... Oh, Jelly's here. Jelly is here, y'all. We got an expert in the chat. She says the best payout for people is Medicaid, which is government funded, but they'll cover the majority and you pay next to nothing until they force you into an HMO. And that's the thing. People who can't afford health insurance are on Medicare. And oftentimes those people who can afford private insurance are not getting care, while the person who has the government insurance is getting care. So the argument of, well, the government is too inept to provide these services, they're already doing it. They're already providing it, and Medicare already exists, and they could just open it up for everyone to sign up, and we'd all be in it, and that would be it. crazy me though. Let's pay $1,500 a month instead and still get denied 30% of the time. 33% of the time, sorry. TRICARE. Jelly says TRICARE is really the best because it's for government employees. See? The government employees, they have good insurance. The Congress people, they got the good insurance. That's exactly correct, Jelly says. Well, thank you. I'm glad I have correct opinions on this because I'm fired up. I'm fired up. I almost wanted to save this for Monday so we could have a little bit more uplifting topic going into the weekend, but honestly, like, I'm so heated about it. Like, oh my gosh, it's just unbearable. When everyone on both sides of the argument says there's a problem, but no one moves to do anything about it, it's absolutely nuts to me. KO says people on disability are on Medicare, and I think that's what effed us over. Jelly says that is also correct. Okay, yes, people who are on disability are on Medicare, but they should be. People who are on disability can't work. And that's the great thing about this country, is that we help people who can't help themselves. And if someone is disabled, like KO's man is not able to work, does that mean that he doesn't deserve the same quality of life that everyone else does? Does that mean, like, oh, well, he doesn't have a job, so he doesn't have health insurance, he doesn't deserve medical care? That's insane. We're throwing away members of our society by the thousands because they don't have enough money to satisfy the shareholders of health insurance companies. It's disgusting. Jelly says, this is my 9 to 5, 40 hours a week, and now you understand why Jelly is not a fun person anymore. You know what? I don't know how you do this, because it would suck the life out of me. I did about an hour and a half of research for this topic, and it just made me so angry. The more you find out about it, the worse it gets. That's the crazy part, is that all of these things are happening behind the scenes, and you don't even have exposure to it until you're in there, and it's too late. You're already bleeding on the table. You already need the operation. Oh, well, you shouldn't have picked that insurance company because they don't pay for things. What are we doing this for? This is crazy. Absolutely crazy. Jelly says corruption took root. Absolutely. At all levels. Above the front line levels of the people who are actually administering the care and making the hospital run, and the janitors and all those people, everyone else is just out for personal gain and shareholder value and profits, and it's disgusting. The health of other humans should not be a for-profit industry. That's absolutely nuts. Hey, Brian Thompson, you get this $10 million here because you're so good at denying people the only thing that they pay us for. And he's celebrated for that. Now, as I said before, this was not the way to go about this, and he did not deserve to die. But all of this hand-wringing and pearl-clutching about, oh, well, this man kills people for a living and makes millions of dollars for it, while you're sitting at home wondering how you're going to pay for your 10 pills next month. That's absolutely nuts. It's robbery. It's... Oh, man. These things shouldn't even be... This shouldn't even be an issue in our country. KO says... her man got the disability. Okay. Right, so we had insurance, and the procedure he had scheduled for 7 months, the procedure that he had scheduled for 7 months. The fact that they have to schedule something out 7 months is also insane. You don't have to reveal what this procedure's for. I don't want you to do that. Whatever the procedure is, though, he needs it. And they said, you need to wait for 7 months before we'll even entertain the possibility of taking care of you. Okay, so there's problem number 1. After waiting for 7 months, the procedure was canceled because his health insurance had changed. So now he has to wait until March. I don't even know what to say about that. How do you not? Oh my gosh. How are you not just on the phone screaming at these people? And it's so hard too, because all of these people on the phone are people like you and me. People like Jelly, you know? People in the struggle out here, and they're pitting us against each other. It's disgusting. Jelly says, I hate my life and everyone around me. I hope you're just talking about work. Because yeah, I can't imagine even working in this industry. It's absolutely insane. My blood is just boiling for KO right now. That's disgusting. I'm really sorry to hear that his care keeps getting delayed because of red tape, essentially. You know what happens in Canada when you need medical care? You just go and get it, and they give it to you. Your arm's broken, you go to the hospital, they fix it, they give you medicine. You know what happens if you're American and you're in Canada? You get shot, or you fall on a I don't know. You get injured somehow. You slip on the sidewalk on a banana peel. What do you think happens then? You think like our system, where if you haven't paid enough money into it, they just kick you out and deny you and charge you triple? No. If you're an American in Canada and you get hurt, they'll take care of you because it's the right thing to do. The fact that we haven't grasped this is just absolutely nuts. Jelly says, that's why I still don't have my tubes tied. They canceled on me 3 times. Then the year was up and insurance changed, so I still have to suffer the birth control or plan B or just That's crazy. What are we paying this for? Why does anyone have health insurance? What are we doing this for? This is insane. KO says, Drew, this is where the money's going. Exactly. We need Chaos Elmo in here. God, I need the Chaos Elmo button. Oh, they sent him a welcome package after 1 month of coverage and a free mug. Here's your free mug you can drink from while you sit there and wait to die from lack of care. Oh my God. Hey, maybe save the money on the coffee mugs. We all have coffee mugs. Everybody has coffee mugs. I guarantee it. I guarantee no matter who you are, if you're watching this, you have coffee mugs. You don't need Molina to send you one. Knock $10 off somebody's... Man, I almost swore. Knock $10 off somebody's prescriptions and keep the coffee mug. You know what I'm saying? Jesus. That is... KO says, Banana peels are hazardous. That's
We're
right.
considered a hazardous building.
Yeah, it's a hazardous building when you got banana peels everywhere. Jeez. Yeah, that's just absolutely nuts. And Jelly, she works in the healthcare industry. You would think of anybody, if anyone's going to be able to navigate this system, it's the person who works in medical billing. But no, even having that inside knowledge does you no good. And oh my gosh. The doctor has to reschedule, so F my shield. Oh, schedule. Okay. Okay, yeah, exactly. Forget about your schedule and the fact that you've had this thing planned for however long. That doesn't matter. Red tape says that we need to move on. We need something else. We need to drag it out for another tons of months for whatever stupid reason. It's just Nugget says when the missus lived in London, she went to a hospital whenever needed and never paid a pence. That's right. If you get hurt in England, you can just go to the hospital and they don't ask any questions. They just take care of you because you're a human being, and that's what we should do. Australia, same thing. That's what they do. You live in Australia, you don't pay. You just go to the doctor, you just go to the hospital, and you just get the care. It's crazy. Jelly says, no, they still try and screw me, and they just look stupid when I tell them they messed up. Exactly. See, and at least you have these skills that you can do something about it. You can say, hey, I see this, and the problem is A, B, and C, and this is how you fix it. The layperson who doesn't even understand health insurance is not going to be able to identify those things. They're not going to be able to navigate these problems. So when they get denied, they have zero recourse other than just Googling stuff. And maybe then you find this video of a guy just complaining about prescription drug prices for 2 hours. Jelly says women are just here to make babies. And you know what? If you want to have a baby, that costs a lot of money too. A lot of money. Oh my gosh. Let's pull that up. The average cost of delivering a baby without complications is around $13,000. $13,524 for delivery and care for the mother, and an additional $3,660 for the care of the newborn. And you're in the hospital for 1 day. That's just to start life on this planet. It costs $4,000 and then another $14,000 for the mom to not die during the process. Absolutely insane. Just I didn't. Yeah, here's the proof on that. That's the. According to uwhealth.org, the average price of delivery is $13,500. Well, I guess I will not be able to afford to have a baby. Oh my goodness. It's absolutely insane that this is even a conversation. But you know what? After all of this, I think that we're starting to get under their skin a little bit. Because now these guys are starting to change their tune. Oh, good lord. Move-in ready assisted living. Okay. I don't know why I got that ad just now. Okay. The new United Healthcare CEO says, we understand people's frustrations with the healthcare system. Do you? Do you really understand? I don't think you do, because these people who work for United Healthcare don't have to deal with the same shit that the people who use United Healthcare have to deal with. Oh my God, it's disgusting. Why does it take such drastic action for our corporate overlords to realize that basic medical care is important to us? Oh man, my chat scrolled up. Okay, hold on. Jelly says, and you're paying most of that. For the child to be born, you're paying that out of pocket. How dare you expect your health insurance company to cover something like that? You only pay $1,500 a month. That'll be 20 grand if you want to have a baby. And then Jelly says, and then you got to pay for the kid for the next 25 years. Well, I mean, yeah, but that's okay. That's expected. KO says, I feel like I would do better where it was where you were conceived in a truck. Okay. I don't know about it. Now, there are lots of stories every year about people who have a baby in a car. And you know what? The baby lives a lot of the time. So why are we paying $20,000 to sit in a bed and do this when you could literally have your baby just in the back seat of a Toyota Corolla for a $500 fee, and then you own a Toyota Corolla? Pat Wooey in the chat says, Drewski, what's up? Pat Wooey, good to see you, man. Thank you for coming. I'm fired up. I'm screaming about healthcare. Nugget Man says, who the F would want to be the next CEO? How much security does that dude have? And I heard of that too. These companies that offer security details for people, they're getting lots of calls now because everybody's a little bit worried about this this vigilante justice idea spreading. And certainly, you know, I wouldn't encourage that, because violence is not how we get things done. But according to this article, we know this, yet we don't fix it. And why not? Opposition from corporations and the elected officials they support and lobby, that's systemic violence. And I didn't even pull it up again. Right there. Systemic violence. So, I think that they probably should have expected this. You know? They should have seen this coming. How long are you gonna withhold life-saving medical care for profit before you anger someone about it? But yeah, these CEOs, they're changing their tune a little bit. United Health Group CEO, America's health system is poorly designed. Oh, is that what it is? It's the system that's poorly designed. It's not these guys who deny 1/3 of all the claims from their customers. It's the system. Oh, Pat Wooey says, nice setup. Looks clean. Thank you. I appreciate that. It's my dying plants in the background. I got my little cat palm. I actually didn't do anything really to set this up. This is just what my office looks like. I added the colored light bulb to the lamp, and that was it. Big investments on this YouTube channel, I'll tell you what. But yeah, I thought it's interesting because we're starting to we're starting to make these guys think, hey, maybe we're not doing something right here, and we should make efforts to change, you know? But see, CNN even says, will changes be made? Probably not, is the answer I would offer. But in their last paragraph, they give an important caveat. Any shifts in the nation's complex healthcare system will not come easily nor quickly, experts say. There are many players involved, each of which has its own patient care concerns, financial interests, and lobbying dollars to influence lawmakers. And that's really the crux of this whole thing, is we can't change it because we don't have the lobbying dollars, and the financial interests of these healthcare companies are solely profit. I feel like we could have non-for-profit healthcare companies, you know? And I just spitballing here, but, you know, maybe we could knock some of the costs down if they don't have to worry about making an extra billion for the shareholders, you know? Everyone to get their dividends. But yeah, so so he says, what we do know to be true is that the health system needs a company like United Health Group, says the CEO of United Health Group. And then, you know, the HMO backlash. I mean, obviously, that's another whole hot button issue is HMOs. And if you want to read this, this is on CNN Business. This is United Health Group CEO. America's health system is poorly designed. And apparently that poor design is what causes them to profit millions of dollars every year. But yeah, I just this is gross. This is a gross way to make money on the backs of dying people. And if you have an investment in a healthcare company or health industry company, you should think about that, because the amount of money that you're making in dividends, you know, whether large or small, is on the backs of people who are dying. People who need life-saving medical care, and they're being deprived so that stockholders can make money. And KO says, I don't know what dividends is. Dividends are paid, money paid yearly per share owned of a stock. So not all stocks provide dividends, but if you own stocks that do, they will give you an amount of money per share you own at the end of every year. And that's what dividends are. It's a little payout, you know. For letting them use your money to kill people faster. Okay, wow. So Jelly has given up on her medical procedure that she's had rescheduled countless times because there's no point. I spent 2 years trying to schedule it. It was scheduled 4 times with 3 different doctors. I'm good. Lord have mercy. That's insane. That's absolutely insane, dude. 2 years just to schedule a procedure, and they're gonna move it around 4 times. Man, see, this is a perfect illustration. I'm really glad you were here, Jelly, because this is exactly the kind of evidence that people need to hear. It's Jelly. KO says, Jelly, I'll get a BOGO going. Jelly says, my friend said the same thing. That's how I got the first one scheduled, but it fell through. Really? You had to call him and be like, listen, I really need this procedure. I found somebody else who also needs the procedure. So if you will schedule my procedure, you can also have their procedure. That's absolutely nuts that we have to do this. At KO says they really want them babies. Apparently they don't, because it costs $20,000 to have one. Absolutely nuts. It wasn't 20,000. It was like 18,000, but still, Lord have mercy. Jelly says, and on top of personal life issues and dealing with everything else, dealing with that stuff every day, that crap every day for work. Exactly. As if you didn't have enough worrying about healthcare to do at your job. When you get home, you also have to worry about your own healthcare. That's nuts. Discouraging isn't a strong enough word. Exactly, man. Oh, Lord. This is just, it's really eye-opening, you know, to hear the story in the news is one thing, and I definitely, you know, I feel for those people, but, you know, to hear from my friends, you guys all having the exact same issues, it really makes it real, you know? I don't know. Maybe that will influence people. You know, if they had to see... KO says, Drew, that's on you to have the baby. Yeah, well, you know, it might be. First, I need to find a woman that wants to have a baby with me. KO says they can tie us together. That's right. Get a double operation bed. You know, you guys can lay next to each other. Maybe you share anesthesia too. I don't know. You get a 2-for-1 discount on anesthesia there. Jelly says basically yes. We tried to bribe the doctor, but insurance said F you, have the babies. Oh my gosh. See, you shouldn't have to bribe the doctor to receive medical care. That's their job to provide care. That's insane to me. KO says, I might know a doctor. He's a radiologist, but hey, he knows the last parts well enough. And that's another thing too, is if people can't afford their health care, they're going to turn to potentially unsafe methods of having an unskilled person provide medical services on them. You know, it's a huge problem. But God, that is just terrible to hear. KO and Jelly, I'm sorry to hear about your and Nugget Man, your experiences with the healthcare system, but it definitely illustrates how widespread this problem is, because we have 6 people here and every single person has had an issue with the healthcare system. That is 100% of people polled hate their healthcare. So we definitely have a problem here. And while I don't agree with the methods that this Luigi guy employed, he's getting stuff done here. And maybe he'll still have a chance to make a positive influence on the health industry, because no one else is trying to. All of these people seem to be in it for the money, and I think the CEOs are kind of having a little bit of trepidation, because they're realizing, like, you know what? I make 10 million a year, but I'm just a normal human like everybody else, and all of these thousands of people that we deny coverage to every day and every year, they're real humans too that exist in the world, and you might have to interact with one day. So, if you work in the healthcare industry and you're watching this, how would you want that interaction to go? Certainly a valid consideration now that I'm sure a lot of these CEOs are thinking through. Yeah, KO says it's only a problem if you get through it to complain about it. Yes, exactly. There's no one here to complain about being denied their health care because they didn't make it through whatever medical issue they're going through and they're no longer here. It's disgusting. Disgusting. KO says, I laughed so hard when I saw every one of them, of the big companies drop the pictures of their top people off their website. Yeah, all of a sudden, these C-suite introductions, not as popular. The CEO and the CFO don't want their picture out there anymore all of a sudden. That's interesting. Pat says, Free Luigi, hashtag Free Luigi. That's right. You know, I mean, we were talking about it before, and the definition of hero is complicated, but you know, and we still don't know his motivations, but certainly what he's done has struck a chord, and I don't think you can unring that bell, you know? Now these guys are gonna have to do some soul searching, and you know, maybe something will happen, or probably not. You know, they'll just wait for it to blow over and get ready for the next shareholder meeting. But honestly, I don't want to see anyone get hurt. I don't want people to get denied health coverage, and I don't want people to be eliminated by other people for denying health coverage. So, in the name and spirit of nonviolence, maybe this whole situation can bring about systemic change. I know it won't be easy, but we gotta try, because this system doesn't work, and there's no excuse not to do anything about it, because we all know what needs to be done, and the players that are driving up the costs in this industry are well recognized. So it's certainly above my pay grade, and it's definitely going to involve some politicians stepping up and actually caring about us too. But I think in this new climate, you know, there's a small chance that could actually happen. So I hope it does. And I hope that you guys are all in good health, and that you get access to the care that you need and deserve and pay for. So I think that's going to do it for the extras. Thank you guys again for joining me. We'll be back on Monday with a little bit more lighthearted topic, something a little bit less heavy. And I hope you guys have a great weekend. And don't forget to hit that like button. That's right. KO says it's all Trump classic right-wing people covering things up, conspiracy theories already. And you know what? Trump is going to be president, and I hope that he can do something to positively influence healthcare, because we definitely need it. Becky, you have a great night. Thank you for being here. Thank you for being first in chat. Nugget Man, Pat Wooey, KO, Jelly, everybody, thank you so much for being here. And I hope you have a great weekend. I will see you on Monday. Peace.